Polio, short for poliomyelitis, is a highly infectious and potentially paralyzing viral disease that has plagued humanity for centuries. This disease, caused by the poliovirus, primarily affects the nervous system and can lead to paralysis and even death in severe cases. However, thanks to extensive vaccination efforts, the world has made remarkable progress in eradicating polio, making it a prime example of the success of modern medicine and global health initiatives. Historical context. Polio has been a known affliction for thousands of years, with references to it found in ancient Egyptian and Greek texts. However, it was not until the late 19th and early 20th centuries that the true nature of the disease began to be understood. In the early 20th century, polio epidemics became more frequent and severe, causing widespread fear and panic. Transmission and symptoms. Polio is primarily transmitted through the fecal-oral route, often via contaminated water or food. It can also be spread through direct contact with an infected person's saliva or mucus. The virus enters the body through the mouth and then travels to the intestines, where it multiplies. From there, it can enter the bloodstream and spread to the nervous system. Many people infected with the poliovirus experience mild symptoms or none at all, resembling a common cold or flu. However, in more severe cases, the virus attacks the motor neurons in the spinal cord and brainstem, leading to muscle weakness and paralysis. This paralysis can be temporary or permanent, depending on the extent of nerve damage. In its most severe form, known as paralytic polio, the disease can cause respiratory failure and death. Iron lung and FDR. One of the most iconic images associated with polio is that of the iron lung, a mechanical respirator used to assist breathing in patients with paralysis of the respiratory muscles. The 32nd President of the United States, Franklin D. Roosevelt, contracted polio in 1921 at the age of 39. He became a powerful advocate for polio research and founded the National Foundation for Infantile Paralysis, later known as the March of Dimes, which played a significant role in funding research and supporting patients. Roosevelt's own experience with the disease helped raise awareness and mobilize resources to combat polio. The vaccine breakthrough. The turning point in the fight against polio came with the development of vaccines. In the 1950s, Dr. Jonas Salk developed the inactivated polio vaccine, IPV, followed by Dr. Albert Sabin's oral polio vaccine, OPV, using a weakened form of the virus. These vaccines were game changers, as they provided immunity against the virus without causing the disease itself. Mass vaccination campaigns, backed by international organizations like the World Health Organization, WHO, aim to immunize as many people as possible. Global eradication efforts. The global effort to eradicate polio intensified in 1988, when the World Health Assembly launched the Global Polio Eradication Initiative. This partnership between WHO, UNICEF, the Centers for Disease Control and Prevention, CDC, Rotary International, and more recently the Bill and Melinda Gates Foundation, has played a pivotal role in reducing polio cases worldwide. By 2000, wild poliovirus transmission had been eliminated in all but a few countries. However, challenges such as conflict, lack of infrastructure, and vaccine hesitancy have made complete eradication a complex task. Nonetheless, significant progress has been made. In 2020, the African region was declared free of wild poliovirus, leaving only a few countries where the virus remains endemic. Challenges and moving forward. Despite the remarkable progress, challenges remain in the fight against polio. Vaccine-derived poliovirus, VDPV, outbreaks can occur in under-immunized populations, as the live virus in the oral vaccine can mutate over time. Vaccine hesitancy, often fueled by misinformation and mistrust, poses a significant threat to achieving complete eradication. Additionally, the COVID-19 pandemic has disrupted routine immunization programs in many parts of the world, potentially leading to gaps in polio vaccination coverage. To finally eradicate polio, concerted efforts are required to strengthen health systems, improve surveillance, and address vaccine access and hesitancy. The lessons learned from the fight against polio can also be applied to other global health challenges. Conclusion. Polio is a disease that has shaped medical history and inspired one of the largest public health campaigns in human history. Through the development of effective vaccines and the dedication of countless individuals, the world has come remarkably close to eradicating this once devastating disease. The ongoing efforts to eliminate the last remaining pockets of polio transmission serve as a testament to the power of science, international collaboration, and the human spirit's resilience in the face of adversity.